Okay. Welcome, colleagues. Thank you so much for joining today's session. And first, I'd like to appreciate you making the time to join in these very impactful sessions that we've started as the laboratory cadre to help ourselves in staying competent and also sharing experience in the diverse fields and areas that we're working on. And most importantly, to also fulfill the requirements of our regulator, the EMDC, and also the quality management system in terms of competency levels. So as the norm, I record the sessions so that for those who cannot join live in this session, they can find them offline, in the online platform that you upload them in. And at the end of the presentation, you usually have a small quiz which acts as our register to mark those who joined today. So I strongly encourage everybody, even if you are sharing the PC in terms of some labs would be joining under one user, but please do ensure that you complete the quiz individually, and then it will mark your attendance into today's session. So today's session is briefly and also detailed in terms of ISO 15189-2022 training competency requirements record as per the standard. And our today's session is brought to you by Helen from the Loop Commission. She has a very strong profile when it comes to private lab implementation and also management of the lab. So her profile is very large. I can't really go in details into it. So without any delay, I would like to invite Helen to share the screen and share your talk for today. Thank you.
Hello, everybody, and I hope you can hear me. Thank you very much for taking the time to come for this CPD meeting, and I hope it is very beneficial to you all. Let me see where I can go now. Oh, I've lost it. Sorry, I'm just going to try to share it again. Okay, there we go. Can you all see?
Yes,
okay.
we can see.
So the title, sorry?
Yes, we can see. Maybe you can put it on presentation or slideshow mode.
I'm trying to find that, to be honest with you.
At the bottom.
At the bottom?
Yeah, next to the Zoom sign.
Sorry? No, sorry, I can't find it.
Okay.
Okay, but yeah, anyway, let's go. Sorry?
You can proceed, Helen. Thank you.
Okay, super. Okay, the title is Laboratory Training and Competency Requirements and Records as per ISO 15189-2022. Okay, welcome everybody. So in this session, we want to go through the exact ISO 15189-22 clauses that mention training and competence, the rationale and impact of competence in the medical laboratory context, how to assess, maintain, and document competence, then also what auditors expect to see and common pitfalls to avoid. In a later session, we will discuss the practical tools and we will go through some templates and real-world examples. Okay, at the moment we have 5 labs accredited, so we're going to try and pick their brains and see what they've done to get accredited. Server Lancet has 2 labs, Imberbarn and EPH, very well done. The National Molecular Laboratory as well, and the National TB Laboratory. So all of these people had to go through competency and training. So hopefully in the next section, we'll pick their brains. Okay. The learning objectives we have to go through is explain the difference between training and competency, identify ISO 15189-2022 clauses, describe evidence required by the auditors, and recognize high-risk areas. Okay, why does competence matter? Competence matters. Accurate results equals safe patient care. Patient safety, the most important, and the ISO 15189 document always talks about patient safety. Inaccurate results can lead to misdiagnosis, inappropriate treatment, or harm. Okay, another reason why competence matters, trust. Clinicians and patients rely on laboratory data for critical decisions. Another reason, regulatory compliance. Accreditation bodies and national regulators, including those in Eswatini, require proof of confidence for all staff. All staff. Continuous improvement. Competence systems helps to identify gaps, drive training, and foster a culture of excellence. Okay, training versus competence. Training is the process by which staff acquire the knowledge, skills, and behaviors needed for their roles. Competence is the outcome, demonstrated, assessed, and documented ability to perform. Okay. ISO 15189-2022 makes it clear, training alone is not enough. Laboratories must verify that training leads to competence and that competence is maintained over time. Training. So if you training, you acquire knowledge. Competence, you demonstrate ability. Training is a one-time event, and there's certain cases where you have to be retrained, of course. Competence is ongoing process. Very critical that. Training, it's not enough alone. Competence must be assessed and must be documented. Okay, retraining required after, you must also do retraining after SOP changes, any major incidents, or any time away from the laboratory and you come back, you must be retrained. Okay, example, I want to try and illustrate an example of training versus competency. So if you're a pilot and you have an engine failure, so you, the passenger on this plane that's had an engine failure, do you want your pilot to be trained or do you want him to be competent? Remember, competency implies that he's already been trained. So competency in action, immediate response, the pilot executes trained emergency protocols. Crew coordination, captain, co-pilot, and cabin. Crew follow crisis procedures. Decision-making, the pilot diverts safely based on weather, fuel, and airport proximity. So your outcome of your training and competency, safe landing due to high competency and rigorous training. That's the outcome you want. Same in the laboratory. Safe handling of specimens due to high competency and rigorous training. Why does it matter? Training ensures familiarity with rare but critical scenarios. Competency means the pilot can apply the training under pressure. Lives depend on it. Okay, now we go to the tricky part, the ISO 15189-2022, where it is mentioned. It starts off with 5.2. It starts right at the top. Director responsibilities. The laboratory director holds ultimate accountability for ensuring quality, competence, and regulatory alignment across all services. Okay, 6.2. 6.2, all accredited laboratories know this is where the trickiness goes. Personnel competence and records. Staff must be qualified for roles with documented evidence of training assessments and ongoing competence. Then 7.3, which is now comes into your process, your examination phase. Testing, validation, EQA. All tests must be validated for internal use, monitored through internal checks, and benchmarked via external quality assessment. Okay, competent people have to drive this. Okay, 8.2 to 8.4, here's your management system, document and control records. The lab must operate a structured quality system with controlled documents and traceable records to support consistent, auditable performance. Okay, very important is the new addition to the ISO 15189-2022, which makes the laboratory responsible for point of care. Okay, Annex A, POCT training. Point of care testing staff, anyone who does point of care, must receive targeted training and competency checks to meet quality and safety standards. Point of care is very, very, very important. I mean, the training and competency of it. Okay, we're going to go through clause 6.2 directly from the standard, the core of competence. 6.2 personnel, 6.2.1 general, A, the laboratory shall have access to a sufficient number of competent persons to perform its activities. B, all personnel of the laboratory, either internal or external, that could influence the laboratory activities shall act impartially. We heard about that earlier. Ethically, be competent, and work in accordance with the laboratory's management systems. C, the laboratory shall communicate to laboratory personnel the importance of meeting the needs and requirements of users as well as the requirements of this doctor. D, the laboratory shall have a program to introduce personnel to the organization, the department or area in which the person will work, the terms and conditions of employment, staff facilities, health and safety requirements, and occupational health services. This comes up again and again and again. Okay, carry on. 6.2.2, competence requirements. The laboratory shall specify the competence requirements for each function influencing the results of laboratory activities, including requirements for education, qualification, training, retraining, technical knowledge, skills, and experience. B, the laboratory shall ensure all personnel have the competence to perform laboratory activities for which they are responsible. C, the laboratory shall have a process for managing competence of its personnel that includes requirements for frequency of competency assessments. D, the laboratory shall have documented information demonstrating competence of its personnel. Okay, examples of personal assessment methods that can be used in any combination include direct observation of an activity, monitoring the recording and reporting of examination results, review of work records, assessment of problem-solving skills, examination of specially provided samples, e.g. previously examined samples, interlab comparison materials, or split samples. In the next session, where we get practical, we will go through that. Oh, that's a bit small. Okay, 6.2.3, authorization. This new standard, the ISO 15189-2022, concentrates a lot on authorization. Please, if you go for accreditation, you must make sure that this is in place in your laboratories. Okay, authorization. The laboratory shall authorize personnel to perform specific laboratory activities, including but not limited to the following. A, selection, development, modification, validation, and verification of methods. B, review, release, and reporting of results. Your staff must be authorized to review, release, and report results. C, use of laboratory information systems, in particular accessing patient data and information, entering patient data and examination results, changing patient data and examination results. Okay. 6.2.4, continuing education and professional development. Okay. A continuing education program shall be available to personnel who participate in managerial and technical processes. All personnel shall participate in continuing education and regular professional development or other professional liaison activities. The suitability of these programs and activities shall be periodically reviewed. Okay, and this, I dropped it. This, our EMDC has made it compulsory for CPD points for identification. So that's a big plus. Okay, 6.2.5, personnel records. This laboratory shall have procedures and retain records for A, determining the competence requirements specified in 6.2.2. So you need to have a record of how you're going to deem your staff competent for such a test. Okay. B, position descriptions, that's your job descriptions. Each person must have a job description. C, training and retraining. D, authorization of personnel. E, monitoring competence of personnel. So it seems to be a little bit of overlap, but it's actually not too much overlap. Okay, so your competence requirements, your competence pathway, orientation, training, assessment, authorization, reassessment, and following on that, CPD. Okay. Required records, and these are records that auditors will ask for. Orientation checklists, training logs. We're going to go into a bit more detail because it's not just enough to have an orientation checklist. You must have the time over when the orientation takes place, what you're going to review and things like that. So in the next session, we'll go through examples. Competence assessments, authorization lists, CPD records, and then you'll also do SOP-linked retraining records. Okay. Oh, can't do that. Next one. A competency matrix. Okay, this is quite good, a competency matrix. So it is a must-have tool. So all labs that are going, please try and look at the competency matrix. For example, here you can just have a spreadsheet, the name, Jade Lamini, the task, what is the task? Trained, January the 10th, preferably put the year as well. Assessed, January the 20th. Please, as far as possible, training and competency shouldn't be on the same day. Okay. Authorized, once they've been assessed and once they've written off as they've been deemed competent, you have to say you are authorized to do this test. Then next review, recompetency, January 2026. Okay, so that is basically a very basic competency matrix. Okay, we'll get hold of the accredited labs and see what they've done for that. Now we're going to get on to what do the auditors want? How are the auditors thinking? What do they want to see? They want to see, clear traceability of training, competence, and authorization. For example, Tech trained in malaria microscopy on the 12th of January, 2025, is assessed on the 20th. Authorized from the 1st of February. That's a funny example because you can authorize it a bit earlier, sorry. All signed and within definite scope. Okay. Next, up-to-date training and competency records. If a new hematology analyzer arrives in March, staff files should show training and validation by April. No blanks or pending entries. Okay. Training linked to SOPs and risk. That's the other major word in the ISO 15189 2022 is the risk. Okay, every step of your work at the laboratory has some form of inherent risk. Okay, it's a big word in the new standard. Okay. Each record should reference the correct SOP, so that's your document control, and note key risks such as sample misidentification or reagent expiry with mitigation included. So you're going to identify the risk. What is the risk? How are you going to fix it? How are you going to stop it from happening? How are you going to mitigate it? Okay, then also what are auditors looking for? Follow up after incidents. After a transcription error in April, for example, records should show retraining, any XOP updates, and the documented incident review, not just a verbal reminder. They want it documented. Remember the famous saying, if it's not documented, it's not done. Okay, let's go to 13. Okay, now I'm going to go through, I've got 10 examples. Typical gaps, common mistakes, and frequent non-conformances. Okay. One, outdated or incomplete training records. So this is what they will give you a non-conformance for. Staff files missing, evidence of training for new equipment that was introduced months ago, non-conformance. SOP updates not reflected in training logs. Staff still signed off on old versions. They love to catch you on that, but they don't like to catch you on that as well. Competency records older than 2 years with no scheduled reassessment documented. Okay, competency has to be a minimum of each year. For high-risk cases, obviously you will do competency more often. Okay, new staff orientation forms not fully completed, missing dates, signatures, or scope. Okay, they will check that. Why does it become non-conformance? Why do these cases become non-conformance? Auditors consider outdated records as proof the system is not controlled or that competence isn't ensured for current methods. Okay, next one. Let me go down. Oh, where are we? Okay, next one. Overly generic, non-specific checklists. Checklists that simply say microscopy instead of specifying whether it was urine microscopy, gram stain, ZN or malaria. Or non-conformance as competency sheets lacking performance criteria, e.g. accuracy of differential count, acceptable smear quality, let's see what that is, error limits. Another non-conformance is repeated use of the same template for every department, no adaptations for chemistry, microbiology, or blood bank. What is your non-conformance trigger? ISO 15189-2022 requires the lab to evaluate competence for specific tasks, not generic categories. Okay, we're going through a lot of these. 3, non-conformance, missing authorization documentations. Staff performing specialized tests, e.g. cross-match, malaria reporting, gene expert, EID, anything without written authorization. You must have authorization for every test. Authorization forms are missing signatures from the designated approval. And that's a big no-no. No evidence of scope of authorization. Staff unclear on what they are allowed to perform and what they're allowed to report. Okay. Why auditors flag this? A trained person is not automatically authorized. Authorization is a distinct requirement. Authorization comes after competency. Okay, another one. A lot of common mistakes and frequent non-conformances. Temporary staff, locums, interns, attachments. You haven't followed the document through. Locums working for months without induction or competency proof. Big no-no. Attachments allowed to handle patient samples without documented supervision. Training files created only for an audit announcement. This is a major, major red flag. Okay, please, you have to get into the habit of competency all the time. It's ongoing, it's all the time. Result, auditors treat this as a high-risk non-conformance because these staff directly affect patient results. Okay, so if you've got locums, if you've got attachments, if you've got interns, please make sure your documentation is in place. If you're training, if you've got any students or whatever, they may not work unsupervised. Okay, unless you go through all of this document, of course. Okay, 5, no evidence of training after incidents or errors. So this is another big thing, an incident or a non-conformance. A serious error, e.g. sample mislabeling, incorrect HIV result entry occurs, but staff receive no documented retraining. Okay, that's a non-conformance. CAPA, that's corrective action, preventative action form, says staff reminded with no supporting evidence. Another big thing about your competency, the person that is being deemed competent, they must keep the evidence. Okay, if you're doing a peer review, you must have a copy of the worksheet. If you're doing, if they're watching how you enter results, you must have a copy of the results that were entered. If you are being deemed competent because you made a mistake and you're sending out an amended report, you must have a copy of that whole amended report before you're deemed competent to carry on. Okay, so please, evidence for your competency. Okay. Then repeated incidents involving the same test or staff member. Why this fails compliance? ISO requires a lab to demonstrate that corrective actions prevent recurrence, not just acknowledge the error. They don't want you to acknowledge the error. They don't want the error to happen again. Okay. 6, inconsistent or missing competency. Staff signed off as competent, but no observation records to show actual demonstration. Evidence. Please make sure you have your evidence. And it is every staff member must be responsible for their own competency. They must be responsible for the evidence and for getting the signatures and to make sure that they are ready. Observed by fields left blank on competency checklists. One person completing assessments for all departments, even where they lack subject matter expertise. These are all non-conformances that have come up and that have been compiled. Okay, audit impact. Competency becomes invalid if not witnessed by qualified personnel. Okay, so make sure that the person training you is competent, is qualified. Okay. Because if someone has not been deemed competent, say in POCT or whatever, and they train you, it's invalid. Okay. The person training you must be qualified. Okay. Some more non-conformances is poor document control and training files. Staff using old SOPs during assessment. Be very careful of this. They will catch you in a heartbeat. Multiple versions of the same competency checklist in the file. Staff signatures missing or illegible. Other non-conformances are electronic training files not matching paper records. Outcome. Auditors view this as a systematic failure in document control. Okay, let's go through. I've only got 10 of these. 8, no training plan or competency schedule. Labs relying on ad hoc training. We train when needed. That's not good enough. Okay, you need a training schedule. Obviously, you can add the ad hoc ones now and then, but overall, you will need a training schedule. No annual training calendar or competency reassessment timeline. Big no-no, so please make sure you've got that in place. Lack of prioritization of high-risk areas. Okay, they will look at your high-risk areas. Blood bank, micro, neonate testing, critical value reporting. Okay, make sure that those are competency for those are put in place quickly. So non-conformance. ISO expects a planned approach based on risk and competence requirements. 9, new methods introduced without competency validation. New POCT devices rolled out without staff validation. New test methods used before staff are assessed as competent. You cannot use a new test until your staff are deemed competent. No evidence of staff participation in method verification. Okay, 10, lack of traceability. Yeah, big one. Files not organized, training, competence, and authorization stored separately or in random order. Please, the auditor doesn't like you to waste time. If they ask you for something, they want it. Whoops, right there. Okay. Unable to respond quickly when auditors ask, show me who is authorized to run the AU for 82 days. So please, all your lab managers, all your head of departments or whatever, put your documents where you can get them quickly. Gaps between, then they will also look, very thing, they'll look for gaps between training, competency, authorization dates. Results, failing the traceability requirements is one of the most common non-conformances across Africa. Okay, so those are basically quite a few of the things the auditors will look for. I just want to touch quickly on high-risk competence. Why does it matter? Or risk-based competence, whatever. High-risk tests require more frequent documented competency checks. High-risk tests, I mean, that will differ for which department you're in, which lab you're in, but some from my experience, blood transfusion compatibility, PCR, arterial blood gas, cardiac markers, troponin coag tests, PI, PTT, D-dimer, UNE, potassium in particular, CSF analysis, any HIV testing, malaria microscopy. Okay. These are high-risk tests. Please, you must make sure people are deemed competent and often. So reassessment frequency, you can make it every 6 to 12 months. Remember, you must redo training and competency after any incident, any SOP update, or any equipment change. Okay, and so here we come to the end, the takeaways for practice. Please know your clauses. Okay, 6.2, training and competency is the main one, but you will find it scattered throughout ISO 15189-2022. Define and assess competence for every role. Competence for your pre-examination, your examination, your post-examination. Every role needs competence. Keep your records audit ready. And I'm telling you, it's not going to work if you say, okay, I've got an audit, and you start leaning out. You must get into the mindset of doing your competency as the people come in and then going from there. Okay. Use risk-based prioritization. Okay, we've just touched on that. Your high-risk tests, make sure that your competencies and everything are in place first and they're repeated more often. You must engage leadership, engage staff. It might be a good idea once a week just to go through your quality indicators, go through your staff suggestions, things like that. You can go through your clauses, anything like that. It helps a lot if you do that. Engage your leadership, engage your staff. Okay. And then last, make competence a living system. Okay. That ends the lecture. I hope you're all still awake. Bongani, over to you.
Yes, thank you so much. Thank you so much, Helen, for such a brilliant and also impactful presentation. I do believe that everybody has grasped the concept and when it comes to do with training, competency, records, and what we're supposed to do is the lab. We all know, colleagues, that training remain our input in everything that we are doing, and competency becomes the proven record of what we are doing on a daily basis as we build the competency. I really like the example in terms of the flight and the pilot and how is the landing and all of that, and the competency metrics as well, which becomes the vital tool for us to measure and also detect when the next training is due. And we know that with the standard 15189-2022, it requires us to be trained, certified, and authorized in all the aspects of the lab before maybe performing the test and be competence on a regular basis to ensure that we still maintain competence in what we're doing and ensuring patient safety and all the quality standards for each lab. Colleagues, let's thank our presenter again for this very practical and also important session. I think at this moment, I would like to welcome a number of questions, maybe from anyone. You can raise your hand, open your mic, and then you can ask your question. Then we can go over straight to the quiz after that. Any question, anyone? Okay, I think I had one, Helen. Maybe you can just go through it for me. I'm just curious to say, which system do you really use in terms of documentation? Like, which one is the most preferred one, when it comes to practical application? Either we use this online version or maybe electronic version in terms of our laboratory documents, or the hard copy is the gold standard. Like, which one is the best one, or which one is the most
Okay.
valid?
I can only tell you in my experience, okay, we're very lucky here. We've got a system called Revelo, and they've done a lot of work on documentation. The standard for the meantime, obviously, is paper documented, but with artificial intelligence and with everything is going electronic. So please try and get a decent system that goes electronically. The electronically makes it so much easier to track. So at a glance, instead of going through a lot of documents to see that each one is signed, if they've signed on an electronic system, you can pull up those records in seconds. And that's where we're very lucky here, is we can pull up those documents in seconds, and we can see exactly who has read the SOPs and when they read the SOPs. So I don't know. I can give you examples of things. Most of the labs, I think quite a few labs, if you're out on the outskirts and electronic, get a system that works for you. You can use Google Sheets. You can use things as long as it works. Yeah, and you can always ask questions, and you can always see if it works, see what people think. So at the moment, there's no definitive answer which documentation system. Get what works for you.
Okay, brilliant. Thank you so much on
Just
that.
make sure that they all have they are all controlled documents.
Oh yeah.
Okay, that's the big thing, is they must be controlled documents. We can do a chat on documentation if you want.
Of course.
I need to brush up on it, but we can do one.
Okay, great. So thank you so much for that, on that response on that one. I also have like two questions from the chat. One is from the NTRL. I'll just read it as it is. They're saying, thank you for the presentation. Would you please share your experience on the method or methods you use for conducting competency assessment? Maybe from your experience, or what works and what would really work in terms of practicality and for ensuring competency assessment when conducting them.
Okay. I can share that. I can give you more on the next, because I'm actually working on trying to make it easier for competency. But I can tell you now that when we had a pre-audit, when the SATCAS auditors came, we were hammered because of our competency was not up to scratch. So we do have an electronic, not electronic, what am I talking about? An Excel version of a competency, and it's very manual, and we're trying to adapt that to an electronic version. So maybe later I can share that with you. That's what I was hoping to do, is give you some examples of this and how we do it. So how we implement competency and things like that. But it's a continual improvement. It's a work in progress, but Excel spreadsheets will work at the moment. So you saw that one I showed you, where it gives you the name, the test that they've done, the date there, and then just evidence. So you can put the evidence in a separate column, put the evidence like peer review, the worksheet, then just scan that worksheet and keep it all together with your things. Maybe we can do workshops and we can all come up with a plan, because these things give us headaches, these things, competency and things like that.
Great.
But we'll work on it.
Okay.
I can go on to the next session. When we do the next section, I promise you I will answer it more thoroughly.
Okay. Okay. Thank you so much on that one, Helen. And also there's a second one from Nomatemba Dube. In the event that a training schedule is made, but due to resource scarcity, the training do not take place, how do we document this for audit?
Okay. In the event that just to say that again, so the problem is if you haven't done the competency, you haven't been deemed competent, you can't run the tests. So yeah, that's a tricky one. So you see, it's up to every single person to make sure that they are deemed competent. You can't leave it up to your lab manager to say, okay, we're having a session now and we didn't do it. Okay, you have to take your responsibility. You're all professionals. You're health professionals. Okay, in Eswatini, the thing with Eswatini is we've actually forged our own way. If you look at all the people that have been, all the labs that have been accredited, they haven't done it with huge pathologists and huge laboratories. They've all done it with their own. So we can do it. That's because we've all taken responsibility. So yeah, it's how do you document it if you haven't? I think just straight as it is, you say, this did not happen. These people are not deemed competent. They are not allowed to do the tests. And then hopefully they'll wake up and ask you to do another test very quickly.
Great. Thank you so much for that response.
Did I answer it correctly?
I think so. But if not, maybe Norma can add or maybe raise another question on it. We can go to the third one from Joseph. He's asking, how many clauses are there in the ISO 15189 2022 standard? Yeah.
How many clauses?
Yeah.
What do you mean? There's 8 that I know of. I mean, 8 sections.
Okay.
Yeah, they're slightly different to the old one. But the clause specifically for competence, you can see it coming up in 5, you can see it coming up in 6.2, that's the big one. Everyone remember that. It's coming up all the time in 7, and it's coming up in your management and your documents and records in 8. So competency and training goes throughout the whole standard. And I sincerely hope you all got copies of your standard available for your staff.
Oh. Thank you.
Joseph, did I answer you?
Joseph?
Yes. Thank you so much, Helen. I got the answer. Thank you.
Thanks, Joseph.
Yeah.
All right. And we also have another one from Kuku Nomalo. She's asking, who specifically can deem somebody competent in the lab when it comes to competency assessments, according to the standard, maybe?
Yeah, because you see, that's a little bit of a catch-22 situation.
Yeah.
So the person who can deem someone competent is someone who has already been deemed competent. The moment you have been trained and you've been deemed competent, you may deem someone competent. Okay. but you cannot, and these are records you can ask for. You say, where's your certificates? Where's your competency record? For example, if you get a new AU480 analyzer or whatever, that's just the one that I know, and Beckman come and they do the training, you get a certificate after you pass the test, whatever, you are now considered by the supplier as competent. You can now train the next person on this thing, and after a whole lot of things, you can now deem them competent. But you can only deem them, first of all, the training, you have to do the training, not you, someone else can, but you can deem them competent once they've fulfilled all the obligations, once they've fulfilled the criteria, your competency criteria, you can deem them competent. That's fine.
Beautiful. Maybe just to add on that one, I think I also have another one. In the event that maybe the supplier who can deem some competent is no longer in the picture, but the lab manager is the highest in the structure of that lab, who does the competency of the highest seat within the laboratory and also ensure that the lab manager or the highest person within that laboratory is still competent enough to deem him or her competent before he or she conducts competency of the rest of the staff?
Not necessarily. For example, I'm a lab manager at TLC. Okay, but I haven't done enough training on our new instrument, the Mindray. So I can't deem any of my staff competent. Okay, but I mean that's something I must now go and do the training, and then have someone to do those certificates to deem them competent. It is a problem, and there is something that I think is accepted, but I'll have to find out more about it, called historical competency. Okay, so that's it. For example, I know we did it a lot at Lancet. I mean, maybe Shirley or Joseph can say is when you've been doing it for years and years and years, and the instrument's quite old and things like that, you can be deemed, and you've done the EQA. You can prove your EQA. You can prove your algae graphs, you can prove everything. You can have historical competency, but that's very hard for them to accept that.
Okay.
Try whatever you may to get current competency. Okay.
Okay.
So for everyone who has got historical competency, it's not good enough. You have to undergo retraining and still carry on with your competency.
Yes,
thank you. Thank you so much on that. And I think that's pretty understandable, and also makes a whole lot of sense to do it that way. Colleagues, I would like maybe just to take in the absentia of all other questions that we might have for today's session. Please join me in completing the small quiz which acts as our register for the session. I think I've posted the link on the chat box, which takes you directly to the quiz. And then maybe on your screen, I'm trying to share the QR code. You can scan it if you can using your phone so that you can go through it. It's just like 10 simple questions in today's talk. And then you can do it maybe as we close.
You doing 10? I told you to choose 5.
Yeah. So thank you so much, Helen, for today. Thank you so much for today's talk. It's very
Hope
beautiful.
you're all still awake.
Thank you. Colleagues, can we complete the quiz or our register? And I'd like to thank you once again. And please stay tuned in your emails. I'll be sharing the video session for today's recording for those who couldn't join us. And you can go through the quiz as well. And then I will also update you on when the next session is for our CMA. From me to you, thank you so much. please do complete the quiz as we
Oh,
are.
I'm sorry, Shaswan.
Thank you.
Hi, Kulan. 8 number. Oh. Yes.